Hi everyone, I'm Sarah at Balanced, and this week I'm here to bust the myth that diet-related disease is a matter of personal choice, and that ultimately our epidemic of poor health is the responsibility of individuals and not, for example, a profit-driven food system. So first, let's talk about choice. We can probably all agree that at least for adults, nobody is really forcing us to eat only fast food 5 days a week. But thanks to the psychology of marketing and advertising, big food doesn't need to force you to do anything in order to seriously manipulate your desires, behaviors, and habits. Research has shown that particularly for children, exposure to unhealthy foods in advertising manufactures a strong desire to eat those foods, ultimately leading to a greater consumption of those health-harming foods. So going back to choice, what if the only restaurants nearby are fast food restaurants and the only places to get healthier foods are convenience stores with much higher prices and limited options? So in these kinds of cases, we're not per se forced to eat poorly, but the barriers to accessing healthy foods are so high that it's simply unrealistic to eat for proper health. Many people, especially in those resource-deprived areas, live far away from supermarkets that would offer a wide variety of lower-cost fresh produce. They may also have little time to prepare healthy meals if they work long hours or multiple jobs. Others may simply have never learned how to prepare healthier meals and may not know how to access educational resources. In these scenarios, is choice even a meaningful concept? I would say not. Between the constraining factors like limited time, access, and resources, plus those behavior-modifying factors like advertisements and an overabundance of unhealthy food options, our choices end up being shaped more by what's most available and accessible in our specific locality than anything else. And that is why the food environment is so important. For the well-being of every individual and our entire communities, we must make the default choices in our food environments the healthier ones. Put another way, the healthiest options should just be the easiest to obtain. This can be achieved through institutional change, such as in schools, hospitals, and workplaces, or it can be through the addition of more healthy, appetizing menu items in your local restaurants. Change can also come from further upstream through government subsidies for fruits and vegetables, in addition to ending government subsidies for disease-promoting added sugars, refined grains, and high-fat animal products. We've come to a place in American food culture where we have difficulty reimagining and bringing into existence a new vision for our food system. But for the sake of food justice, for the sake of human flourishing, for the sake of liberating more people from a life of increasingly poor health, we must reclaim the very same food environment shaping tools that the food industry has used to create a disease-promoting food system and repurpose those tools for the benefit of American lives. Thank you so much for watching this week's installment of the Balanced Mythbusters series. We hope you enjoyed it, and we hope to see you again soon for our next installment of the Balanced Mythbusters series. Bye, everyone!